welcome back. Yes, we're still in the same outfits and stuff because really this is just going to be a couple, we're doing it all on the same day. I just wanted to split it up into 3 different videos, and today we're doing clinical related questions. So, let's introduce ourselves again.
Oh yeah. I'm Melanie.
I'm Charlene.
I'm Kelly.
Hannah.
And we all went to school together, and we all precepted in different places and did clinicals in different places. So the first question on our list is, where did you precept? The unit and then the hospital.
Okay, so I did my preceptorship in a cardiac step-down ICU.
And your experience?
Oh yeah, so we were doing a lot of heart transplants, a lot of aortic valve replacements, a lot of heart surgeries there, and some lung transplants as well. A lot of VADs, so ventricular assisted devices, so it's like an external heart that the patient wears on the outside of their body, and it's all about troubleshooting.
Like Denny Duquette, guys. Don't cut the LVAD wires. Don't do it.
Never.
I cried so hard. And now the same actor's on The Walking Dead, and
He's bad.
And then and he's bad, and I just can't stand it anyway. Side note.
So I precepted in labor and delivery, and I really enjoyed it. It gave me a good chance to really work on time management. Even though in L&D you usually have no more than 2 patients versus other units you'll have 4 to 5 or more depending on where you work, what state. But I feel like being able to work with a mom from the beginning of her birthing process to the point where she delivers her baby and know emergency interventions for any conditions that may arise throughout the delivery or after in the immediate postpartum period was a really good learning experience, because it was kind of a combination of acute care. You had to be ready for anything that could happen, but it was also in a sense predictable. You had a typical outcome of what you would expect for most of your patients in the birthing process.
And I was in the pediatric ICU, and we did a lot of kids that had, I saw sepsis, I saw overdose, there was a lot of kids who were trached and were on ventilators. It was kind of all over the board, and a lot of the kids were really acute. The nurse-to-patient ratio was either 1-to-1 or 2-to-1 at the most. So it was pretty intense, and I learned a lot, and I had a good time.
I precepted in the OR, the operating room / PACU, and it was absolutely amazing. Very different from floor nursing. It's 1 patient at a time, just case by case. You're rolling them in and out of the room. It's pretty exciting. I highly recommend it if you love the blood and guts and the surgery type deal.
What is the best networking advice you guys can give?
I would get to know your nurse managers on the unit from day 1 or earlier if you can. They're so helpful with networking for jobs in the future, give a lot of advice. They know all the ins and outs of the hospital you'll be at, to know about different educational things. So I would know your nurse manager. It's hard if you have night shift, but go find them out. Go find them.
So I'm kind of I agree with Melanie, but I also happen to precept and do clinicals at a hospital where the nurse managers have no control over hiring, and they never hire new grads. So no matter how much the nurse managers liked me, they could not hire me if they wanted to. So for me, I think that networking in general, whether it's with your friends, family, everybody, if they know you're a nurse and you're looking for a job, everybody knows somebody. And honestly, a lot of, especially in California, a lot of the jobs that get found for new grads have some kind of an internal connection.
It's not what you know, it's who you know, and that's very true for a lot of jobs out there. So if you can network with all of the nurses that you know in your area, and joining clubs and getting those extra certifications, you meet people there too. So yeah, always keep a smile on your face, because you never know who you're going to run into.
The thing I was going to add is always, everyone said, always have that face on that you're a nurse, even out in public, so you can meet somebody. So I always kept my business card, and so sometimes you come across a nurse or someone introduces you oh, I'm a new grad nurse, here you go, here's my contact info, and they can pass it along to other people. So just always be aware you can find somebody.
So the next one is kind of a tricky one. How do you handle grumpy / mean nurses? Because if you haven't started your clinicals yet, you'll notice that everybody says this, nurses eat their young, and it's hard and it's difficult. How do you guys handle that?
What I do is I try to kind of flip it around to, instead of having them, oh, can you show me again? Like, oh, I really want to make sure I do it right, and I know you have so much. Can you teach me? I kind of make it like, do me a favor and brace me with your knowledge, kind of thing. Try and make it less of me not knowing what's happening, but like and learning opportunity. That doesn't work all the time, but it's been pretty successful. Sometimes when people are grumpy though, nothing you do will make them trust you or accept you, and sometimes you just have to just kind of keep rolling with it. So keep positive, but also know that you can't change everybody. So.
So I'm very different from Melanie in the sense that I have a hard time not being fake per se, but if I know that somebody is being, I guess I can't really curse, but somebody is being a very mean person, it's hard for me to be like, oh, but will you please just teach me because I know you're the best. So for me, my approach is that I figure out very quickly the vibes that you're getting from somebody. Okay, this person doesn't like new grads, doesn't like people doing clinical, students on the floor, whatever it may be. Okay, fine. Assuming that they aren't your preceptor, you are okay. It doesn't matter. You can avoid them. If they ask you for something, always be polite. Always, do what you can. But for the most part, just kind of stay out of their way. Do not, unless you have to, ask them for things. If you know that they don't like you, and there's 4 nurses to choose from to ask where something is or the code for something, just kind of stay out of their way, because some people you just cannot make like you, and certain people, for whatever reason, forget that they were once students, and so they don't respond well to students in general. And no matter how sweet you are, no matter how many baked cookies you bring to the break room, it's not going to make them like you. So sometimes you have to just embrace that and roll with it.
My advice would be to be upfront with your nurse. Let them know at the beginning of the day if you know that we take up a lot of time. Students take up a lot of time, and you can let your nurse know that you're okay, that if they get really busy, that you're fine kind of taking a step back and just watching and shadowing, instead of, you trying to start the IV 5 times, maybe they'll get it right off the bat and they really need to be doing something else. So if you're just open and honest, and if you let them know, like, if there's an opportunity that I can have with another nurse, I'd be happy to do it. And hopefully maybe that'll help them understand that, you want to work with them instead of being really needy and kind of against them, and they're getting things done.
Yeah, be very appreciative of their time, because they are busy and they're taking time to teach you. However, if they're just straight up snarky with you, and you did nothing wrong, don't let it bother you. Just brush it off and move on. Don't let it ruin your day. Just stay positive. And if you did do something wrong, just admit it and, apologize. It's a learning experience.
One of the last questions for this video is, have you ever had a patient yell at you or a family member yell at you, and what did you do? Maybe not yell at you, but be angry with you.
For me, I keep thinking of this one circumstance. The patient themselves happened to be had a variable mental state, so they didn't exactly know what was going on all the time. They were really confused, and I was tucking him in after cleaning him up. I put the sheet on, and then I was about to put a blanket on, and he was just like, that's not the way you do things. You put the blanket, then the sheet on top, and he wanted it backwards. So I just was, it's like, well, normally I put the sheet down first, but any way you want it, I can flip it for you, no problem. I flipped it the other way, and he asked me the same question. His family came in going, what are you doing? You can't even put a blanket on correctly. So it was kind of like balancing between both him and the family, going like, I'm just trying to make you happy. Whichever way you'd like to do it, I can do it for you. Didn't understand. It took about 10 minutes till the family got that things are not clicking right now, but I was trying to just remain calm and just let the patient know you're there for them. I'll happily assist you. And it was really hard to navigate him yelling one thing, his family yelling one other thing, everyone really being confused. But now I just kind of laugh about it because, it's kind of silly, but I just keep thinking, They're not mad at you.
Mm-hmm.
Things are going on. Just try your best. If you can't, then that's life, kind of. You just keep going.
So I am not sure how, but I got through nursing school without ever having a patient or their family yell at me, so I can't really speak on this.
And I was almost in that situation too, except for, of course, the last day of my preceptorship.
Oh.
The O2 sat, one of our little PICU gals kept pulling all her leads off, and she was going to be transferred up to just the normal floor and not, be in the ICU. And so they don't get continuous monitoring up there, so I called the doctor and asked him, can I take off the leads and the continuous monitoring? And he said, yeah, sure. So then the parent came in, and he just might have been having a bad day, but he started questioning me, like, why isn't the O2 sat on my daughter? It's always on my daughter. It's at home. And I said, oh, I'm so sorry. I called the doctor and asked him if we could take off. He said, I don't understand, why would you do that? And so I just was honest with him. I said, oh, I didn't see anything in the chart about that. I said, let me go ahead and make sure that that's fixed, and we'll get the O2 sat right back on her, and just be polite and try not to be too offended. Like, when I went out of there, I was about to cry. Like, this guy just like chewed me out about like 5 things, and maybe he was having a bad day. I don't know. His daughter's in the hospital. Like, that's already bad enough to begin with. So just try to be accepting, and if it's in your power, try and help the patient or the family get what they need. And if it's something that you need to escalate to the doctor, then you can do that as well. But just try and get what they need. And you can also, since you're just a student, bring your nurse into it. My nurse wasn't in the room at the time, so I was kind of like stuck on my own, deer in the headlights kind of thing. So it was really kind of scary for me. But bring your nurse into the situation. If you guys bring your clinical, not clinical supervisor, your charge nurse into the situation, and then if you need to, you can go up the chain of command to see what you can do for the family and the patients.
So if someone's really yelling at you, they're having a bad day, especially a patient. They do not feel good. That's why you are caring for them. So just stop, listen to what they're saying, and do what they say and do what they want, because you're there for them. You really want to provide that patient-centered care.
If it's safe.
Of course,
Within reason.
Yeah.
Within reason.
Yes. Patient-centered care. Be patient. Be polite. It's probably not you. It's really just their frustration that they're taking out on you.
Okay. So that's all the questions we have for clinical today. Our next video is going to be one on interviews and job-related questions, and we'll have that out in a few weeks. So we'll see you guys later. Bye.